so no pa na se e kwantu obi a ye bom pan se Nyankopon bon ye ho ban ye hwe ho so yie. We take care of ourselves and ask God to protect ourselves and our families from any accidents. But accidents can happen. And when they do, what do we do? Because Mattis say 62 car accidents no it's in a one sheni year. And your accident in the Bekuni panel. Now, one so ni muyi, and the woman paconimum, and watching and us with them. To understand what to do, we have our very own specialist, Dr. Aggrey from 37 Military Hospital, to teach us an idea or betray what we can do to save ourselves, to help our friends, and even be a good Samaritan. Doc, welcome to Wonderful Healthline.
Thank you. Thank you.
I hope I said it right, right? It is true.
Yes.
Mishandling can cause problems.
Certainly. And there are so many efforts by a lot of stakeholders to prevent accidents. And accidents will happen. We can reduce the incidents, but accidents will happen. And when they do, we as ordinary citizens need to know what to do. And doing the right thing at the right time could save a life. So it's a chain, and we have to make sure we are not the weakest link in that chain. From when the accident happens till a qualified doctor sees to the casualty. For
the sake of understanding what you meant by a chain, can you briefly tell us the big parts of the chain and the critical points of that chain?
So from the time an incident happens, a road traffic accident happens, two cars collide or a car collides into something.
Or some assaults.
Or some assaults, yes, that can happen, right? Casualties, they're both injured. Now they are first responders, those who will go there to see. So the first group of those, or the first group who respond to the casualties, play a role. Those who would communicate, asking for help, will play a role. The hospitals or the ambulance system that would come in and pick the casualties play a role. Then the hospital where the final treatment would happen also plays a role.
Talking about ambulances, these days, you know, you have good Samaritans that actually put accident victims in their cars. So they also play a role. Yes,
they do. And that's the transport part of the whole chain. So if we had enough ambulances, then we could safely wait for an ambulance to pick up casualties, but we don't. So there will come a time, or often, good Samaritans need to use their personal vehicles or taxis or other commercial vehicles to transport patients. It's not the best, but this is what we have now. So we need to know a few safe practices. So till we have a system where we have enough ambulances, we can safely transport casualties from the site of the accident to the emergency room or to the hospital. So
talking about safety measures and what we can do, can you show us a few, please?
Yes, certainly. And then, so this is our approach to it. We think first of safety, then we think of communication, then we think of something called the triage. When there are a number of casualties, you see to the one who is most injured first, right? Then you do your first aid, apply your first aid, which will involve you having your skill and having the right equipment. They go together. Know what to do and have the right equipment. Then the third part for this discussion would be transporting the patient to the hospital. So these are the 4 areas. So I would then demonstrate.
Yes,
all right, so I'll just put this here. All right. So
na ye hunu doc we dwane shirt chese okobo obi na se ohwe na atade na ohye na apata ni bi ana se de be hawa na we release won sa no because adwuma akoye no eye moja ho adwuma de e be hwe no misram wanwa moja de ha mo adwen paka no munyi wani na mbusa munwase na ye no because doctor na de opeso kire pa sister no mprai misram a kind of makeup for you now, my dear now, mama na looking real, but and real, and Japan, you can stage props since I'm your money beer. Son, I'm but see, I say ye. It's a doc, over to you.
Right. So the first thing is safety. Make sure the environment is safe. No fire, no live wires, no weapons around. Then the second thing is to protect yourself. So I've got my first aid kit here. I'm going to put on my face mask.
One cast of a ball home buying. Smart, I say. wo hwe say ja bia na say wire bia do endo be bia na say mum be nsuo bi bibi e be ma wapura wankasa wo make sure say wankasa no wabɔ ho ban yie ansa na wakɔboa obi nti won say do ko hye ni face mask to protect ho wakɔboa obi.
So this goes on, then you have a pair of gloves.
But your gloves ne wo hia o wo dun sa fin koso ekro ni mu a wan ha wan makro no kra sai nti yesra mu amu yem pe gloves nhye ye ayi no mu first aid kit box no.
All right. So like I mentioned earlier, you need to triage. So in this instance, I would assume this is the most severely injured person, and I'll start to see to her. So we'll break it down to the bare minimum. So first of all, you need to reassure the patient. So, madam, are you okay? Okay, good. I'll try and help you. Where are you injured? Okay. So now she's injured on the leg, on the arm, and on the scalp. So I would ask her to apply a bit of pressure here. Then I'll first see to the wound on the head.
Why the head first?
Right, because the scalp bleeds a lot.
Okay.
Right. And then the approach is to first start with the head, the body, before you go to the limbs. Okay. Head, body, limbs. Okay. Yeah. So this is a simple rule of thumb we can follow. Right.
The doctor patient say, "Ukotu so be a pra, and uncle for do a pra. Ubehwe the way pra kese pano. No, I started one so. We started so I want so continue first. I didn't I'll say, ade omuye. Etini to me moja to me new wetini mo more saying the akano into ye tina no ahwe no upper body na hasro ha no so we pra wo hoso so a no ahwe no awie ansa na waba enan no rule of thumb doctor for no ade omoye sanipa no moja ntu no ananyu no ema bibi enye no into mo hwe se no chichiriti no.
Right, so make sure you don't cover the eyes and you don't cover the ears.
Doc,
right?
We saw that you put something on the wound before.
Yes.
Gauze and now cutting wound.
Yeah, gauze to apply a bit of pressure.
Okay.
Now, if you run out of gauze, you can use anything. Okay, a piece of cloth. Yes, it may not be clean, but our focus now is to prevent bleeding that could lead to death.
Doc say, adibi to kro no so. Baby a moja ni nyu no ansa na o chichiro de bandage ni chichiriti no bandage mam no kata nani wo ho but o say ehun hia sade ni nye clean kram dem fanto so sa because moja na ye pese sote ye pese obenyu na na wawu enuntia nti mo chichiri ni say ya.
Right, so next we are not sure of how much blood she's lost, so it's always safer to have the patient lying down or the casualty lying down. So please come lie down.
Onya sure moja dodo enyu ni pakro ni no ma na da ho.
Okay, now over here we can see a wound and then we assume there's a fracture. So the important thing to do is to prevent the excessive movement of the limb. So you can improvise. I have a pre-made splint here, but you can use anything at all, any rigid object to immobilize the leg. And we need to stop the bleeding and keep the leg still. So that's what I'm doing now.
Inti doc say because we pra one 9 inti no ono na ka say monhwa top first but ohwe ne nan na bia na nan dompanimu abu eno no ho hia say o ma dompanimu mbu entoa so inti no obetumi de bibia support 9 na ye straight no no obibi ode ye wa ha but wo kroma na bibi na esi a edua kra bia ye straight flat a obetumi de 9 na to so na ma so boko se na oye no na wo de achoke 9 no wo say wa ya ma aka ya ka ne say wo foot ni nyina wo we de twi na mba papa wo ho mfa ncheme afi ode bandage no chichire sana 9 no movie so ahu say yes stiff because a movie be na don pene bua ebe koso abu nkitenkete afọ be hospital na 9 no asay na esi etwa to twene nti esa wo ya ade we pa na ya na ne boko mun kai mun say hu say osa de ade tu kro no so ansa na o chichire se na ye eti na the same thing na o ye o de fa 9 no hu nyina asa na 9 no movie nti we de ye hia gauze pa doc.
Yes, ye hia. Ye hia.
Pacho doc, wo ye we no say wo use safety pin bi amfa nso bibie mu anasa wo plaster bi wo baby na ode ye na ye hu.
Dabi. So usually at the accident scene with the haste and all the rush and all the chaos, you may find it very hard to do all these fine movements. So you can tie the bandage. If you've got the plaster, use it. But remember, this is happening on the scene. And there'll be a lot of chaos and all. So we want to work as fast as possible. So if you can tie it, go ahead and tie it. If you've got the safety pin, go ahead and use the safety pin. And if you got some plaster, please go ahead and use it. If you have more bandage, yes, go ahead and apply. Okay. Then now I'll see to the wound on the upper limb.
Doc so be friend Sunday dia no ba dia o ka fa na ne ho ne se bibusa ne sanye bia o me hu se onyusu pin bia fa nso bandage ni mu na bibi na o se ade no ko na ade na to san po frim san no e bia na oni pin won ho e bia plaster kra wudi nti so betu ma chechira bo mode na bopo kakra sana bandage na wa chechira no ensane na 9 na 10 na de a wo ye no ensei nti esi ano se na o ye ba ko na no wasa de gos fufra sa to nsa no so ana o chechire na fe no wa bopo no kama.
So the focus here is to prevent bleeding, which could lead to death.
Moja na nyuni pa na na yebo modern say enkoso anyu no because moja de esa na no anu no nti no ehu hia se ebe chechire kama na de pressure kakra to so na
right. And the last part is to immobilize the upper limb, and we have a triangular splint or sling over here. So this is what we do. We stand in front of the casualty. Then the tip of the sling goes to the elbow of the injured arm. I put the arm over it. I tie this over. Then you can tie it behind the casualty.
Doc, so nisa triangular aibia. Utumi de duku bi ya na.
Yes, you can use a scarf. You can use a piece of cloth.
Is it important for it to be a triangle? So you have to shape it into a triangle before you use?
Yes, easier.
Okay.
Alternatively, if he's in a shirt, then you could open a few buttons and tuck the hand in.
Okay. Okay.
Yes.
Into doc say, mu duku blue no de ye na. Once duku ni de triangle dada. Aha, but say de wo no ntuma na duku na wo no enye triangle sa. Utumi bubo mane ya say triangle no because the mane easy. Oh ya umbre pi na otun dia hye nsa no se na oye no e de kire won nsa no sa pepe adenti ne ye ne sa na nsa no eno susu move e bia na no susu no dompe no ebu kakra ana se ekro no susu be ha na adwen a no aye ne sa ba se bia woni bi na npa ko ne hye shirt dia otumi bie buttons ne kakra na ama ne nsa no de hye mboko de wuya ne se nsa no entutu nko left ne right na move rough.
Right. So as I mentioned earlier, we are not sure of how much blood she's lost. So it's always good to keep the casualty lying down and if possible, to elevate the legs. Okay, so if we have maybe a small, anything at all that could lift up the legs a bit, then blood flow to the head will be improved, if possible.
Okay. Doc say, because of moja no a enyu nipa kro no, woni moja kokro dodo a sorry abesenko. Nti nke be ya abanya bibi kakra bi na onso na oma sister nan so na nka wa ma nipa kro na nso kakra bi. Onso moja no be do afusane yie na ebia na nisuchie ni sa anwoma ni nyina no ebeba fom.
So before doing this, remember to always call for help.
Answer our best start.
Okay. Always call for help.
Okay.
I was working alone. It was a bit clumsy. But I can imagine if I had someone to work with, then it would have been easier.
And faster.
And faster.
Doc, who you name Pabua? Adentia.
Right. Now, as part of assessment, we need to expose the limbs to see if there's another injury.
Okay.
And then once we are not sure of what we would say her hemodynamic stability, that means how much blood is lost.
Okay.
Right? Then it's always good to make sure that clothing is loose, and then we elevate the foot.
Okay.
Yes.
Mibusa doc sada na oyi mpaboa no. Osini nyina aka se ne check se npa ko ni impra baby fofora na se moja ne difusane ye ni sa anwoma ni nyina eka ho. Nti obi o hye moku bia se me die bia yin ni nyina mfa ho so na okọ wedding. Enya won e besle. Ne mu nya normal. Na afa ni obi ntumi mboa ye. Afa so se yen kai se be fresh obi nso emu ne ntumi hwe nipa kro no because wonkwa wo ya wa hwa na apepre no wapra nipa kro no nti no mombo modern na obi betumi abo amane mboa na mo ho nye ha.
And lastly, remember to reassure the patient. Okay, so help will come soon, okay? Just relax. If there's anything, let us know, okay?
Doc se no wa kro de obo ano no oni na kasa boko mentia ntia o ye na o se agi ya mesre mentia ne pi eya why eya o se mo kokro ne ka che ne se o enche ka na ma friend na obi ba mu de ne be hospital onya abotre ayire chechire e wo nipa ho ohun areche wo nipa ho nti doc ka chen adi pi suya dio bichi this one barof
why are there
doc that's it. Any take home message for us?
Right. Yes, the last point is that when you encounter an accident scene, remember that you don't need to know everything about the casualty before you bring them to the hospital. Often you hear people saying that, oh, they are these casualties, I don't know them, I don't know anything about them. What am I going to tell the doctors when I come to the hospital? We don't need that information.
Okay.
If we have that information, it helps us. But without that, we have a protocol of assessing an injured patient and giving them the needed care. Okay. So once you are in an accident, you encounter an accident scene, if you can, assist with the first aid, assist with the transport, assist with calling for help. You don't need to know the incident that happened. You don't need to know the person or the casualty involved. Okay.
Okay. Doc say, the last message or the man say, you so be a pranas and be a man slow, what train ye, and who soon here say beyond him pacrono, ne faraby, and I say, medical history be answer na wabuano there be. And we answer protecting us not chain ye. Now, about the neighbor hospital, so I mean, so be all about one way jaw home because so so do hospital. Dr. Busan assembled to me yano. And yes, sir, Dr. Fonin him don't be young, beshin pacrono, and who here son pacron unim nanasa wun nimno. Mama yam wire honey who na Ghana yen Lucy very, very productive people in because of accidents, right?
Okay.
Oh, Dr. Aggrey, yes. That's it.
Okay, yo, Miss Medasi.
That's it. Fine, dear. I hope so. In church, and so me, talk me any.
Oh, we in the year. We in the year. And the key thing is practice.
Practice makes perfect.
Practice.
Doc, I can be answer na your best starting na. Rent me, I'm kind of one. Am I? Or say first, you may impemp in any cars move be. More than say, move a pharmacy, my tosan, you may gauze now. Once you issue gauze, panny bandage debris. Then make sure, say, I will first aid kit me. Now, when you're sure the woman, upper pharmacist, on a super complete first aid kit, but more don't hear you now. Mr. Moa, now, Uber do now one for chill. Yeah, that's it. We'll be right back.